We've been discussing cell biology, but not everything that takes place in your body takes place inside your cells. So let's talk a little bit more about the extracellular environment, starting with collagen. Collagen is the most abundant protein in our bodies, and it's what provides structure and order and substance to our extracellular space. There are 4 main types of collagen that you need to know about. There are actually almost 30 different types of collagen, but there are just 4 that you're most likely to be tested on. For type 1 collagen, I want you to remember the word strong. So we find type 1 collagen in strong structural tissues like bones and skin, and also the dentin of your teeth. So type 1, strong. You might remember that the word bone contains the word 1. Also wound repair, like scar tissue. Scar tissue is tough and strong, so you really have a lot of type 1 collagen to strengthen that healed wound. For type 2, I want you to remember the word slippery. Type 2 collagen is found in slippery tissues like cartilage and the vitreous body of the eye, and also in the nucleus pulposus in your intervertebral discs. Type 3 collagen is stretchy collagen, so it's found in stretchy tissues like the blood vessels and the skin, and also the uterus, which needs to be able to stretch a lot. Type 3 collagen is also found prominently in embryonic and fetal tissue and in granulation tissue, which is part of the wound healing process. We're going to look at that later. But granulation tissue is beefy red and shiny and often kind of wet looking. Type 3 collagen also makes up a type of filament called reticular fibers, which forms the connective tissue stroma in these organs and tissues. And you can remember it as 3 reticular fibers for collagen type 3. And then type 4 collagen is found in the basement membrane. So again, type 1 is strong, type 2 is slippery, type 3 is stretchy, and type 4 is the basement membrane. So there's an awful, disgusting mnemonic for this, which is to think about a strong, slippery, stretchy BM. You know, BM for bowel movement, but here BM stands for basement membrane. So a strong, slippery, stretchy BM. Now, a less scatological mnemonic is simply the word scab. The S is for skin, which is type 1. The C is for cartilage, which is type 2. The A is for arteries, which is type 3. And then the B, again, is basement membrane, which is type 4. It's not quite as comprehensive a mnemonic as the other one, but it's still pretty decent. So now that we know where we find these types of collagen, how do we make collagen? Well, the synthesis and especially the modification of collagen is about a 3-star topic. About half of you are going to have a question about the post-translational modification of collagen. So here there are 6 main steps. First, the basic peptide is synthesized in the rough ER of fibroblasts. So what are fibroblasts? They're the cells that create scars and fibrous tissue and collagen. So they translate the mRNA and synthesize a polypeptide called pre-pro-collagen. Lots of proteins are synthesized as propeptides, and then they're cleaved or modified to become the final protein. But this is actually first synthesized as a pre-pro-collagen. This is going to become the alpha chain of the collagen. These alpha chains have a very unique structure. You either have glycine, proline, X, where X is any other amino acid, or you have glycine X hydroxyproline. Now, there can be more than 1,000 amino acids in a row, so these are really long peptides. So that's the first step, synthesis of pre-pro-collagen alpha chains. The next step is hydroxylation of lysine and proline residues. This is the step that requires vitamin C. So if you don't have vitamin C, you can't hydroxylate collagen, and basically you stop right there. If you can't make collagen, you end up with scurvy. This is why vitamin C can prevent scurvy, because it's so critical in making collagen. It's also the reason that vitamin C is important for wound healing. Now, you probably remember how sailors would get scurvy because they were stuck on a boat for months and months and months without any fresh fruits and vegetables to eat, and they would become vitamin C deficient. Then once they figured out to bring along some lime juice, make sure everybody on board got a little ration of lime juice every day, they could prevent the scurvy.
It's scurvy.
The third step of collagen synthesis, still inside the fibroblast cells, is glycosylation of the hydroxylated lysine residues. And then you add some hydrogen bonds and some disulfide bonds, and at this point you've gone from that pre-pro-collagen to pro-collagen. And here we start to see the structure of collagen taking place, which is a triple helix of 3 alpha chains. The fourth step is exocytosis. So at this point, you've done as much as you can inside the cell. But collagen is a huge molecule, so you can't assemble it completely inside the cell. In order to finish the processing of collagen, you have to export the procollagen and finish constructing your collagen outside the fibroblast. The next step then is to process the procollagen into something called tropocollagen. So basically, you cleave the terminal regions of procollagen, and then you have tropocollagen. That's proteolysis, cleavage of proteins. And then finally, you cross-link a bunch of these tropocollagen molecules together to make these enormous collagen fibrils. So this is a covalent bond, a covalent cross-link between lysine on one alpha chain and hydroxylysine on the other. So you do all these cross-links, then you've got your collagen. One thing I want to mention just in passing while we're talking about collagen and wound healing and scar formation, what do we call a scar where there's too much collagen deposition? This is a keloid. A keloid is a scar with too much collagen. And one way we can treat keloids is by injecting the keloid with glucocorticoids, because steroids inhibit collagen synthesis, and that's something worth knowing. Next, let's talk about 3 diseases of defective collagen synthesis. First, we'll talk about osteogenesis imperfecta, then we'll touch on Ehlers-Danlos syndrome and Alport syndrome. Now, osteogenesis imperfecta, or OI, is a bone disease where you have fragile bones. You can guess from the name that you have imperfect genesis of bones. Osteo is bone, so this is osteogenesis imperfecta. Now, there are a whole bunch of different subtypes of OI, but the most common type is OI type 1, which is an autosomal dominant disease where you have normal type 1 collagen, but just not enough of it. Or in some cases, you might have slightly abnormal type 1 collagen. Either one of those can occur. But remember, type 1 collagen is your strong collagen. It's found in your bones. So if you don't have it, you're going to have multiple fractures with even minor trauma, and then leg and arm deformities as a result of those fractures. I mean, kids are always falling down and running into things, so these kids are always breaking their bones. And they might even develop bowing of the long bones in utero, which you can see here. They can also have blue sclerae because the sclera is deficient in collagen, so it becomes thinner and it's somewhat translucent, so you're able to see the choroid right through the sclera, which kind of gives it a bluish or grayish color. That's usually a dead giveaway. If they give you a picture of a patient with blue sclerae, they're giving you the diagnosis of OI type 1. Or they might show you an x-ray of a child with tons of fractures in various stages of healing, and you're either going to think about OI or you might think about child abuse. Now, don't mistake one for the other and ship this kid off to CPS or foster care. It could be a case of OI. So how do you tell the difference? You look for those blue sclerae. You might also look for hearing loss because the ossicles of the middle ear can be affected. And you can also look for dental abnormalities because that type 1 collagen is found in the dentin of the teeth as well. Then on the other end of the OI spectrum is OI type 2, which is so severe that these kids die in utero or maybe within the first couple of days after birth. It's sometimes called perinatal lethal OI. So type 1 is much milder than type 2 by comparison. Next, let's talk about Ehlers-Danlos syndrome, or EDS, which is another type of collagen defect. Again, there are a whole bunch of different subtypes of EDS, and review books have been getting this wrong for ages, so I want to break it down and try and get it straight. There's classical EDS, which affects mainly type 5 collagen and also type 1 collagen. Now, we didn't talk about type 5 collagen because it's not one you're likely to be tested on, but type 5 collagen interacts with type 1 collagen while the collagen fibrils are being formed. So a defect in type 5 collagen can look a lot like a defect in type 1 collagen. Now, patients with classical EDS have hyperextensible skin and joint hypermobility. Hyperextensible skin is where you pinch the skin, and instead of stretching like this, it'll stretch like this. And joint hypermobility means that these patients can bend their joints in all sorts of freaky directions, like bending a finger all the way back to scratch their wrist. 100 years or so ago, some of these individuals with classical Ehlers-Danlos syndrome were circus sideshow performers with names like the Elastic Skin Man. Now, there's another type of EDS called hypermobility EDS, which has joint hypermobility without the hyperextensible skin. Now, the exact genetic abnormality for this type has not really been discovered yet. And there's yet another type of Ehlers-Danlos syndrome called vascular EDS, which is due to a defect in the synthesis of type 3 collagen. Now, which type of collagen was that? Strong, slippery, stretchy, BM. So this was the stretchy type. So type 3 collagen is found in the blood vessels. So again, this is vascular Ehlers-Danlos, and it causes arterial rupture and hemorrhages and easy bruising. You can also see intracranial aneurysms with Ehlers-Danlos. So again, blood vessel problems. Now, one last collagen disease to mention is Alport syndrome. Alport syndrome is a genetic defect of type 4 collagen. Which one was that? That's the BM, the basement membrane. Alport syndrome affects type 4 collagen in the basement membrane of the kidneys, which leads to nephritis and kidney failure. We also have type 4 collagen in the basement membrane of the ears, so these patients can have hearing loss. So kidney disease plus deafness equals Alport syndrome. Then also sometimes you might see eye problems, specifically cataracts or something called lenticonus, where you have thinning of the capsule around the lens because the basement membrane of the lens also has type 4 collagen. So if you remember the mnemonic for reactive arthritis, can't see, can't pee, can't climb a tree, you can change that mnemonic around a little bit for Alport syndrome so it becomes can't see, can't pee, can't hear high C, eye problems, kidney disease, and deafness. So that's it for collagen. Now, what else is found in the extracellular matrix? Well, there's an extracellular protein called elastin. Now, elastin sounds like elastic because it's stretchy. It's even more stretchy than type 3 collagen. So what tissues do we find lots of elastin in? Well, tissues that need to stretch and expand. So it's found in the blood vessels, especially the arteries. The alveoli of the lungs have to be able to expand and fill up with air. It's found in the larynx. And also the spine needs to be able to bend and stretch. So we have elastin in the ligamenta flava along the spine. Now elastin has a lot of proline and glycine, whereas we said collagen is rich in proline, glycine, but also hydroxyproline, which is kind of unusual. And elastin is non-hydroxylated. So that's another difference between strong collagen and stretchy elastin. Now structurally, instead of an alpha chain triple helix, we have proteins called tropoelastins that are held together by a matrix of a glycoprotein called fibrillin. And fibrillin is also made by the fibroblast, just like collagen. And if you have a defect of fibrillin, that causes Marfan syndrome, which is characterized by hyperelastic joints, kind of similar to Ehlers-Danlos, and also problems with the heart valves and the aorta, like aortic dissections. Marfan patients are also often very tall, they have really long arms and legs, and they have long spidery fingers, which we call arachnodactyly. So these are the hands of a patient with Marfan syndrome, and you can see that the thumbs are so long that the entire distal phalanx sticks out when he makes a fist. This is called Steinberg's sign. And in this patient, you can see the long, thin limbs and those long fingers again, and he has a chest wall deformity called pectus carinatum, where the sternum protrudes anteriorly, kind of like the sternum of a bird. This is sometimes called pigeon chest. So again, Marfan syndrome is a defect of fibrillin, which makes up part of elastin. There's an enzyme called elastase that's supposed to degrade elastin. And there's an enzyme called alpha-1 antitrypsin that inhibits elastase. Now, this is clinically relevant as well. What happens if your alpha-1 antitrypsin is mutated so it doesn't work properly, so it cannot inhibit elastase? Well, this is a condition called alpha-1 antitrypsin deficiency. Elastase is uninhibited, and it goes around breaking down elastin left and right, out of control. And so with increased degradation of elastin, you're going to get destruction of elastin in the alveoli, which results in emphysema, a pan-acinar emphysema. So if you see emphysema in a non-smoker, think about alpha-1 antitrypsin deficiency, especially a young non-smoker. The other clinical finding in alpha-1 antitrypsin deficiency is that this defective alpha-1 antitrypsin molecule can accumulate and polymerize in the hepatocytes, and that leads to liver disease like hepatitis, cirrhosis, and even hepatocellular carcinoma. All right, that's it for collagen and elastin. Next, we're going to get into wound healing, but first I want to briefly talk about a topic that's related to wound healing that's not really found in most review books, and that's the different mechanisms of angiogenesis or neovascularization. So if you want to regenerate tissues and heal a wound, you're going to need blood supply, right? So there are a couple of interesting ways that this can occur. One way is that you can grow a new vessel branch off of an existing vessel. This starts with enzymes called metalloproteases, which contain zinc. Metalloproteases are responsible for remodeling and reorganizing the extracellular matrix. These metalloproteases can come along and kind of degrade and soften the basement membrane of the existing blood vessel. And then growth factors like VEGF, which is vascular endothelial growth factor, causes the vascular endothelium to proliferate and migrate toward the area that needs a new vessel. Then you have other signals like fibroblast growth factor, or FGF, that recruit supportive cells to come in and lay down basement membrane for this new vessel. The other way to grow new vessels is that VEGF can also recruit endothelial precursor cells, or endothelial progenitor cells, to come out of the bone marrow where they normally hang out, and these cells migrate to where they're needed, and then they can grow new vessels and connect up to the existing vascular bed. So now that we know about how to make collagen and how to make new blood vessels, we can talk about how to heal a wound. For the first few hours after you're wounded, you're going to have hemorrhage and clotting. It may just be small microscopic bleeding, but those ruptured, wounded vessels are going to leak and bleed, right? Then over the course of the first 24 hours, there's going to be acute inflammation. and we said that the cells of acute inflammation are the neutrophils. And of course, those chemotactic factors are going to come into play here to flag the neutrophils down and make sure they get to the right place. Then on days 1 to 3, you have 3 overlapping things going on. The neutrophils are being replaced by macrophages, which come in and clean things up and clear out all the cellular debris. You have granulation tissue being formed, with fibroblasts coming in and laying down collagen, and vascular endothelial cells coming in to reestablish the blood supply. And what type of collagen did we say was found in granulation tissue? Type 3 collagen. And then once you have a nice bed of viable granulation tissue, epithelial cells can start to migrate in. This is called epithelialization, mobilization of epithelial cells to repair a skin wound. Now this happens pretty early on, and it's clinically relevant because post-op bandages after surgery need to be kept on for at least 48 hours. You're going to keep the bandage on for the first 48 hours so that epithelialization can take place. You don't want to injure that wound in any way or create any sort of osmotic damage with water or soap in the first 48 hours. Now after 48 hours or so, you might clean the wound occasionally, but in the first 48 hours, you want to let the process of epithelialization take place. Then over a period of months, you have more and more collagen production. So at first it was type 3 collagen in the granulation tissue, and now it's more type 1 collagen, that strong collagen that's involved in scarring. So now we're ready for the end of session quiz. So I want you to pause the video, go through those questions, and then we'll go through them together. All right, first question. What findings are associated with Ehlers-Danlos syndrome? So with classical EDS, you get hyperextensible skin and joint hypermobility. With hypermobility EDS, you get joint hypermobility with basically normal skin. And with vascular EDS, you get easy bleeding or bruising, arterial rupture, and intracranial aneurysms. Next, what are the different types of collagen and where can they be found? Well, remember, a strong, slippery, stretchy BM. Type 1 is the strong one, found in skin, tendon, and bones, as well as the organs. Type 2 is the slippery type, found mainly in cartilage, the vitreous body, and the nucleus pulposus. Type 3 is the stretchy type, which is found in reticular fibers, the walls of the arteries, the skin, the uterus, fetal tissue, and granulation tissue. And type 4 is found in the basement membranes, or the basal lamina. Next, which amino acids are found in large concentrations in collagen and in elastin? So in collagen, you're going to find lots of glycine, proline, and hydroxyproline. In elastin, you're going to find lots of glycine and proline. And the last one, what's the role of vitamin C in collagen production? Well, vitamin C is important for the hydroxylation of lysine and proline. So if you lack vitamin C, like in a patient with scurvy, there's going to be a defect of collagen synthesis resulting in poor wound healing, swollen gums, bleeding, and anemia. All right, that's it for the quiz, but we also have a couple of rapid-fire facts. Hyperflexible joints, arachnodactyly, aortic dissection, and lens dislocation, this is Marfan syndrome, which was caused by a defect of fibrillin. And then hereditary nephritis, cataracts, and sensory neural hearing loss is Alport syndrome, which is due to a defect in type 4 collagen. Remember, can't see, can't pee, can't hear high C. And then also be sure you can recognize Ehlers-Danlos syndrome and scurvy as well. We just went over both of those. Very, very high yield. All right, that's it for this video. I'll see you next time. Hello there. Today we're painting a portrait of a sweet young lady with osteogenesis imperfecta. What's the classic facial feature of osteogenesis imperfecta? Right, it's the blue sclera, those beautiful blue sclera. So let's take our knife, and we're going to pick up some of our titanium white and mix in a little Prussian blue. Then we're going to get just a little roll of paint on our knife, and we'll go up here to our canvas and just fire it in there any old way. Any old way you want, just like that. There are lots of different kinds of osteogenesis imperfecta, but most commonly there's a mutation in the gene for the alpha chains of type 1 collagen. Or maybe sometimes there's a problem with hydroxylation, but usually it's a mutation in the alpha chains, an autosomal dominant mutation. Looky there. Isn't that beautiful? I think so. It's just that easy. Well, the little clock on the wall says we're just about out of time. God bless you, my friend.